Welcome to the Business of Healthcare podcast from the Center for Healthcare Leadership and Management. The center is based at the Naveen Jindal School of Management at the University of Texas at Dallas. The show, like the center, brings together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare industry. I'm your host, Dr. Bob Kaiser, Director of the Master's Program in Healthcare Leadership and Management for Professionals.
Today, we have a special message for our audience. As we all are aware, there is a COVID-19 issue that we're all learning to live with and measure through and make differences in our lives, how we study, how we live, how we work. We want to make sure that we take advantage of this opportunity to focus in on some of the physician leaders and administrative leaders that are in the marketplace that can give us some insights to how they are planning and dealing with COVID-19. As you know, a lot of people are reporting from home or from office space that they're not accustomed to, as are we. At UT Dallas, the university is under lockdown. So this particular podcast is actually being coordinated through modern technology from different locations. So the quality and audio that we typically strive to have may not be up to par. But bear with us and we'll do the very best we can to make it as professional as we can. So we have Dr. Britt Berrett, who you're all familiar with. As you know, he used to host the Business of Healthcare podcast, and he's got a great history of 25 years in the healthcare industry. He's the former CEO of Medical City and Medical City Children's here in Dallas. He's also the recent past president of Texas Health Presbyterian Hospital in Dallas, which is a 900-bed acute care facility. He was the executive VP of Texas Health Resources, one of the largest integrated healthcare systems in the country. But in 2014, Dr. Berrett joined the Jindal School of Management at UT Dallas as a director of the Center for Healthcare Leadership and Management. And he's got a number of really great relationships with physician leaders and administrative leaders in the community based off his background. So Britt, we'd like to take this opportunity to really bring more of a frequent view to what's going on in terms of this current pandemic situation and get your insights on that. So welcome to the podcast.
Bob, what a pleasure and a delight to be with you. Thank you for the invitation. The Business of Healthcare podcast is a tremendous tool for aspiring healthcare leaders and current healthcare leaders to understand some of the dynamics within the business world. I understand you're over 150,000 downloads so far, and congratulations, that's remarkable. But I think it speaks to the appetite. We need well-prepared healthcare leaders that are communicating and coordinating and collaborating. So we live in interesting times. This pandemic has certainly been a game changer for virtually every aspect of our lives. And to this point, healthcare specifically. I've been on the phone and visiting with numerous healthcare leaders, and we've had discussions about how healthcare has changed.
For certain, the adoption of technology has been a very dominant role in recent times.
Oh, absolutely.
People that have not been inclined to use social media and some of the telecommuting, virtual, telemedicine, everything applications, through a video conference. We do our classrooms. So having that capability really allows us to reach out and get connected and be able to collaborate, like you said. So I think this is an interesting opportunity for us to all sit here and take advantage of new ways of doing things, and certainly take advantage of the freshness of the content that we can share with our constituents. So we'll plan on doing this more frequently during this COVID-19 period of time. Britt, I think you've got enough relationships out there that you can tap into, and we'll have them join with you, and we'll have a new series of more frequent podcasts.
Yeah, it's interesting. Behind the scenes, healthcare leaders are talking. It's difficult to communicate in such a transitional period of time for us to get the media involved in that conversation. But a podcast like this is the perfect venue. We could talk with leaders from New York to California to Florida to Seattle who are dealing and struggling, and there are lessons to be learned. There are tremendous lessons to be learned. And our intent, obviously, is to pull some of that information out. This won't be the last pandemic we'll have, right? Many have said this is just a dry run for something even more lethal. And so the lessons we've learned along the way will prepare us for the future.
Well, there's a lot of information out there. As a matter of fact, sometimes there's so much information that it's toxic. I call it infotoxology when you have so much data, that you can't begin to handle it. So what we're trying to do is bring forward what we consider to be very direct and very meaningful and beneficial information. And we're really trying to stick to some of the insights that people are experiencing. So that's the value that we're creating for our audience. So thank you, Britt, for being part of this initiative. And we look forward to many more of these, specifically reaching out regarding COVID-19.
Delighted.
Thanks for listening to the Business of Healthcare podcast. Join us online at businessofhealthcarepodcast.com to find episode links, notes, and more. Be sure to subscribe to the Business of Healthcare podcast on Apple Podcasts or your favorite podcasting app. To learn more about the Center for Healthcare Leadership and Management, go to jindal.utdallas.edu and then search under the Center and Institutes tab on the navigation menu. Also, we want to hear from you. If you'd like to provide feedback, make suggestions for future guests or show topics, or just want to get in touch with us, email us at healthcarebizpodcast@utdallas.edu. Biz is spelled B-I-Z. And let us know how we're doing. I'm your host, Dr. Bob Kaiser, with the Center for Healthcare Leadership and Management, where we're leading change by changing how we lead.